Hi, I'm Tom Clark, and welcome to Medical Minutes. It's estimated that more than 1 million American women suffer with fibroids, which are benign tumors that arise from the uterus. While it is rare for them to turn cancerous, they can make life miserable with pain, pressure, and bleeding. Today, I'm with Dr. Brandon Kang, an interventional radiologist at Gwinnett Medical Center, to learn more about uterine fibroids and what you can do about them. First, welcome, Dr. Kang.
Thank you for having me.
Now, if a woman has uterine fibroids, what are her options?
First of all, if a woman is asymptomatic or does not have any symptoms, then treatment is often unnecessary. When symptoms develop, as you mentioned earlier, with pain, heavy bleeding, cramping, bloating, constipation, and sometimes urinary frequency, treatment options are available. Medications such as birth control pills, hormone therapy, and anti-inflammatories can sometimes help relieve the symptoms, but doesn't actually solve the problem. Traditional options have been hysterectomy, which is surgical removal of the uterus, or myomectomy, surgical removal of individual fibroids. Sometimes these require large incisions, and sometimes they can be done laparoscopically or even with the Da Vinci robot system. But these have their drawbacks. They require general anesthesia, have a long recovery time, and have a surgical complication risk. The least invasive way to treat these fibroids is with uterine fibroid embolization. This is a non-surgical procedure that preserves the uterus while treating every single fibroid. It's very effective, up to 94% symptomatic relief. There's short recovery time. The cost is significantly less.
Now, who is a good candidate for this procedure?
It's a woman who has symptomatic fibroids, a woman who wants to keep their uterus intact, and maybe a woman who may not be a good candidate for surgery or a surgical risk. UFE, or uterine fibroid embolization, is performed by an interventional radiologist who uses imaging guidance and x-ray guidance to guide a little catheter, a small flexible tube inside the blood vessels. Tiny particles are inserted into the catheter, which blocks the blood vessels supplying the fibroids, causing the fibroids to shrink and die.
Now, I understand that this procedure is actually good for other conditions as well. Can you explain that?
Absolutely. The procedure of embolization itself has been around for over 35 years. Now, embolization in referring to the uterus can be performed for other reasons besides fibroids. Sometimes after a surgical procedure, a gynecologic procedure, or a pelvic procedure, there's heavy bleeding that can be stopped with embolization. Sometimes after birth of a baby, there's uncontrolled bleeding, and they're asked us to come in and embolize the vessels as well.
Well, thank you very much, Dr. Kang. We appreciate your time. A lot of great information that we got today. If you'd like to learn more about uterine fibroid embolization, visit GwinnettMedicalCenter.org or call 678-312-5000 for a physician referral. For everyone here at GMC, I'm Tom Clark. Remember, when you need current, accurate information, check out Medical Minutes at GwinnettMedicalCenter.org.